The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Today's show, we have Dr. Ann Peled, who is coming to us. Remind me where you practice again, Ann?
In San Francisco.
In San Francisco, which is much more beautiful weather than here in Houston, Texas. And she is going to talk to us a little bit about her experience as a plastic and reconstructive surgeon, but also her experience as a patient. So welcome to the show, Ann.
Thank you so much for having me.
So everybody always wants to know, how did you find yourself in the shoes of a plastic surgeon?
So I actually have parents who are both doctors. My sister's a doctor too. And I started doing breast cancer research when I was in high school. And I went to medical school thinking I was going to be an oncologist like my parents. And actually was like, I'm going to be anything but a surgeon. And did my first rotation in surgery, easiest place you could do it, just get it out of the way. And I remember this night doing a transplant and I instantly fell in love. It was like a true in the OR moment, love story done. And I had this great experience the next week of getting to work in the OR with some plastic surgeons who happened to be coming to close a urology case I was doing. And that was it. I ended up taking a year off in med school to do plastic surgery research. And really, ever since, I've just loved so much. I get to continue to be in the breast cancer space because I'm also fully trained as a breast surgical oncologist. So it's kind of this great mix of still my breast cancer roots, but then also getting to do plastic and reconstructive surgery, which I love.
You know, it's so funny because, like, no matter how somebody found their way into our specialty, it's always like that same kind of twinkle of like, I just love it. I can't tell you sometimes even why. I just felt like right, you know?
Completely. And I also tell people, when medical students ask me about what they should go into or thinking about it, the plastic surgeons I met, I remember they loved their jobs, and they were so excited to show other people. And they asked me if I wanted to stay and do more cases with them that day. And I just thought, like, how cool is it to love your job enough that you want to inspire and excite other people to go into it? Like, that feels like a really good sign as a good field to choose.
Absolutely. And I think in medicine, a lot of us choose based upon that feeling that, you're like, I just belong here.
Exactly. I know. Like, these are my people. And I think, again, what we do day in and day out, I know you feel the same way about it, but it's just so exceptionally rewarding to get to be a part of people's journeys in the way that we are as plastic and reconstructive surgeons. And that's also something I love to share with people. And I definitely felt instantly when I was thinking about what I wanted to do.
Well, and you are a very unique person because not many people are both the breast surgeon and the reconstructive surgeon. How is that? Like, are there other people out there? Is like, are you unique in this?
I would say in this country, actually fairly unique. I'm not the only one, but there's kind of a small number of us. But it's so interesting in other parts of the world, this is very standard, where people are fully trained as breast oncologic and breast reconstructive surgeons. So in Europe, for instance, most of the breast surgeons actually do every kind of reconstruction except maybe microsurgery. And I think in many ways, maybe we're moving more towards this just because, at this point, being able to do both pieces, I think really helps patients in terms of coordinating care and feeling like someone is understanding their full journey and how the oncologic part plays into the reconstructive part and vice versa.
I think you're right. I think it makes a lot of sense. And so much of it is dependent on the setup. And we don't always have control over that when we're in a situation like most of us where we have a breast surgeon who is providing that first step. And so you can't be more in sync than with yourself. So.
I know. I always joke with my patients. I'm like, sorry for better or worse. Like, I have to own all the parts of it, and whatever happens, I know I'm responsible for. But I think one of the things that I love when I talk to people about what I do is that if you find the right team as a breast and plastic surgeon, like I like to think you're getting kind of very close to the same level of coordinated care, because people are so much more thoughtful nowadays about how we can do a great job treating cancer, but we can also have great reconstructive outcomes. We can think about how people look, sensation, how they feel. There's so much more to it than there used to be, even if it's, two people instead of just one person like I am.
Correct. I mean, I think that the whole team concept in a lot of different surgical specialties has become more and more prominent because we do a lot better when we're all working together versus independent islands of surgeons.
Completely. The silos is really tricky. And I do think, especially for breast oncologic care and reconstruction, it's so important because a lot of times what I find is that people aren't even offered the full spectrum of options. Whereas if then they get that referral to a plastic surgeon, that plastic surgeon might bring up, oh, maybe you don't need a mastectomy at all. You could have a big oncoplastic reduction, or, oh, you need radiation. Let's think about other options besides, a mastectomy and an implant in some cases, things like that. So I do think that team approach, ideally from the time of diagnosis, is the best thing for patients.
And I know you're somebody that is kind of been an advocate for breast conservation when it's appropriate. I feel like there's different schools of thought on that, and there are some maybe more conservative, old school residents who feel like a mastectomy is needed in every case. How do you kind of approach that when patients come in and they're really interested in talking about breast conservation?
Yeah, I mean, I think one of the things that's so hard, and I'm actually a breast cancer survivor and I've been through this myself, so I know what these conversations are like. And I think one of the things that's so hard is a lot of people, you hear you have cancer and instantly it's a double mastectomy, I want to be done. And it's totally makes sense psychologically while people feel that way. But I think when we look at data, like people do better from a quality of life standpoint with breast conservation. But oncologically, the outcomes are the same. And so, what I really try to sit with people is to think about what are their real goals. If your goal is, I never want to go through a mammogram or an MRI again, well, okay, let's talk double mastectomies, right? But if your goal is, I just want to be able to get back to my job, exercising, life as soon as possible, probably, a mastectomy and a flap reconstruction isn't right for you, right? So I think it's really trying to kind of understand what people are looking for, both short term and long term, and help them understand how to make that decision. But it's really hard. It was hard for me as a patient. It's hard watching, other people talk to patients about it. I do think it's a very nuanced conversation.
It is hard, and when you get diagnosed, nobody's planning for that, and so it's really hard to kind of be able to step back and make a decision that's like maybe the decision you make if you had time to plan for it.
Yeah, no, I agree. And I know, I think a lot about, for instance, I'm sure you see this too, like with patients coming in for aesthetic surgery. A lot of times people say things like, yeah, I've been thinking about this for years, and that is so much more time to be informed and understand your options. And it's still scary, right? It's still a real decision, but I agree with you completely. Like it's such a good point that you didn't have years to plan for this the way a lot of other parts of our job, the kinds of patients we're seeing have really thought through this more carefully and had a lot more time to think about it.
Right, and I think sometimes I see people a little earlier or later, and sometimes they're still just in such shock that this is their diagnosis, and so that's again goes back to having that team that's like not just there to take care of you surgically, but mentally really support you while you're kind of trying to figure out and navigate all of this.
Yeah, completely. And I think, I don't know what you're seeing there, but I'm seeing a lot more people actually coming in with genetic mutations that they found because we're doing a lot more genetic testing, a lot of celebrities talking about breast cancer risk assessment, which I love. But that's also a really hard place for patients to be in too, even though they don't have cancer. They have this kind of, people will say, like a ticking time bomb. So I know for me, I find those conversations, I don't know what, you feel when you have some of those, but can also be challenging because even though they have time, it's still not something they would pick. And it feels very fast also, even though we don't know you're going to get cancer tomorrow. So I don't know. I think also those can feel kind of urgent too.
I think those are really challenging, especially when they're very young and they're like, "Well, I like how my breasts look, and maybe I won't." And that's where, yeah, it's just hard because you're like, "Well, I think you want a great aesthetic result for everybody," but if I feel like even more pressure to really get a really amazing aesthetic result for somebody when I'm like, "Gosh, they don't have cancer." Yes, there's a probability that's high, but they don't have cancer at this moment.
Yeah, I completely agree. And I was telling someone, I did several mastectomy surgeries with reconstruction today, and I was saying, and one of the things I love the most about my job, it's challenging, but that I love, is that the aesthetic expectations are really high now in mastectomy and reconstruction. Like I have my patients send in wish photos of how they want to look the same way I do with my patients having breast augmentation. And it's kind of remarkable to think about how different that is from 10, 20 years ago. No one would have been able to think we could achieve results that look like you've had an augmentation. And again, I feel like I'm sure you feel the same. It's a lot of pressure on us, as you mentioned, but it's also a really beautiful thing that we've managed through technology and techniques and just caring more to be able to achieve those kind of results.
Well, and I think it's like causing everybody to elevate their standard of care. I saw somebody not that recently, like where she was coming from, there really was one option for reconstruction. It was someone who just really, you could tell, like, was kind of, this is the way I do it, and told her that it was her result was good enough is what he told her. And it's just like I could tell like that crushed her. And I was like, well, there are times where yes, maybe you've achieved all you can, but those words I didn't, I was like, I would hate for someone to say that to me. And guess what, we could get a better result. um and
Exactly.
and so I think as more and more people are offering a better level of care, it may put some people out of business doing it. And I think that's an okay thing because we could be given great level of care for everybody.
No, I completely agree. And it's really the idea that we all elevate everyone else is so true. I know for me, when I first came to where I'm practicing and in my system, there actually weren't a lot of people offering oncoplastic surgery where you're doing breast reconstruction at the time of lumpectomy, which a lot of people know about mastectomy reconstruction, but not as much about lumpectomy reconstruction. And I have to say, like some of my happiest patients are people where it's like, okay, you need a lumpectomy, but also, can we get you this breast reduction you've wanted for years, but never did because it felt elective? And there weren't a lot of people doing it at the hospital I started. And once I started doing it and patients were coming and other surgeons might be losing patients as a result, then those referrals to other plastic surgeons went up. And it is really neat to see how you can make that change in your community and how that spreads out. Again, I think that's a really beautiful thing about learning more, and how we both love to learn about new techniques. And I know you feel the same way I do about like how incredible is it that we're going to do something different next year than we were doing this year and continuing to grow in that way.
When you're somebody who's really, that's part of the mission of you being a plastic surgeon because you're also pushing things in a good way when it comes to neurotization. It would always be accepted that you have a mastectomy and you're numb. That's what it is. It could look great, but and that's not something that you felt like was okay. And will you talk a little bit about like your work and how you got started in that area?
Yeah. So, even though I was already a breast cancer surgeon and a breast reconstruction surgeon for when I got diagnosed, I'd already been in practice for a couple of years at that point. I have to say it is such a different experience being a patient and being on the other side when you're actually the one thinking about the long-term effects. And I remember I got diagnosed when I was 37. It was really unexpected. I always joke it's the no family history, triathlete, vegetarian. I felt like I was doing all the things like many people do.
Yeah.
But I got diagnosed with stage 1 breast cancer at 37. And when I was trying to figure out what to do, one of my friends had had a mastectomy a couple of years before. And she said, I put on a sports bra and I don't know it's on. And I just thought, how can, like, there's so much more to it also about sensation, but just that sheer fact that I work out every day, like my life would be dramatically changed to have a massive part of my body numb in that way. And so at that time, it really didn't feel like the right choice to have a mastectomy, even though many people would when you get diagnosed that young. But I ended up having lumpectomy, and my husband is a peripheral nerve surgeon. So he had been doing nerve surgery for years. And so we actually were talking over dinner when we were making decisions about everything. And it was kind of, why can't we look for nerves, keep the ones that you can from an oncologic safety standpoint, and then reconstruct them in the breast at the time of mastectomy with implants, like just with nerve grafts, just like you do for hand surgery or have a nerve repair you need somewhere else in the body. So I was kind of crazy, but I had my surgery January 2018. And we did our first, what we call sensation preserving mastectomy in February 2018 and kind of have it look back. So I think at this point, and we've done 1,200 of them or something around at this point. And it's really, it's so rewarding and gratifying to have women come in and say they don't even think about the fact that they had cancer or that they had a mastectomy. And I really don't think that was possible, as like you said, as beautiful as you can look, if your body's numb, if your nipples don't respond to touch or temperature, if you feel like you don't feel water on your chest, like there's no way you can psychologically move past it. So I think that's the most fun part about this is people, they stop thinking about every single day what's happened to them.
That's amazing. Have you found that, like, you've been able to that people have been open, I guess, in the community, in the oncological community for these type of procedures, or has there been, like, some resistance to people learning new techniques with this?
It's definitely been resistant. I've definitely gotten a lot tougher than
I
I
knew the answer to that, I'm not gonna lie, I set that one up.
I know. I was actually telling someone the other day, I'm like, I'm just a lot tougher than I thought I was going to need to be. But I mean, honestly, there's not a week that goes by that I'm not kind of like talking people down about the fact that there's nothing oncologically unsafe about reconstructing nerves during mastectomy. But I try to remember, that one of my mentors was one of the first people doing nipple sparing mastectomies. She tells stories that when she started, people would go crazy at breast surgery meetings, like that's so unsafe. How can you do that? And now we know
Yeah.
that that doesn't increase your chance of recurrence. So I
Mhm.
try to put it in that context. But I think there's one kind of the general oncologic concern, which fortunately, again, doesn't play out in our data. But I think the second thing is, and it's hard to learn new things that add on time. It's also hard if you don't totally understand that they matter. And so I will say, like, sometimes I will have patients of mine who go talk to a surgeon and they'll say, like, oh, like, my patients don't talk about having lost sensation. And I think sometimes, right, you
Do you ask?
the right
Like, do
environment,
you ask?
exactly. Did you
Yeah.
did you talk to them about it? And I think a lot of people, it's women's bodies. It can be sometimes, we talk about sexuality and intimacy, and these are conversations a lot of people never got training in. It feels awkward and uncomfortable sometimes. And so I think a lot of people don't engage. And so they don't know how much it matters until you start having those conversations.
And I think too, there's still some of that sentiment that you're alive, be happy. Like, and I yes, totally, you're alive, be happy, but also you can be alive and happy and have sensate breasts and feel, it doesn't. They're not separate of each other. And I work with a number of different breast surgeons that all have different feelings, and I have one that really, and she would tell you, she goes, it's just a nipple. It's just a nipple. I mean, and I was like, "Well, yeah, but it's not your nipple." So, I mean, you know, and so it is hard. It's hard because I would say every breast surgeon I work with is very caring, but everybody just has their background or training, what they feel is necessary, not necessary, and education does take time. It does take time for people to adopt new things.
That is 100% true. It also takes time out of your practice to go get trained and learn that. I also think like one of the things I find when I put on my different oncologic versus plastic surgeon hat is I think kind of what you were saying as plastic surgeons, I think we have to be really open to the possibility of patients wanting different things, right? On a regular basis. I always say, like, oh, that's not an augmentation look, let's say, that I would pick for myself. But you know what? That is wonderful. It's safe. It's what you've chosen. Great. Let's do it. So even though in my head I'm thinking those things, it's let's make it happen for you. And again, it's the most fun seeing people come back happy and feeling good about themselves. And so I wonder sometimes if some of it is we're just in general really open to the possibility, right? That in fact, these parts of people's bodies really do matter, and it matters to their sense of self, and that things, you can engage in conversations with people to kind of make the assumption that how people look and feel actually really drives how they overall interact with the world. And I think, again, we get that unique perspective because we're plastic surgeons.
I never thought about it that way, but I think you're right. Yeah, if we made everyone in the image of what we thought was nice, then every single person we treated would look the same, and that's not it. Our job has always been, whether it's cosmetic or reconstructive, to listen to what our patients want and help them see what they want to see in the mirror. So that's a really good way of putting that, and why we maybe think a little differently sometimes.
Yeah. No, and it's I think the other thing that the and not or is what we always talk about, and I agree with you completely that I think that ability to understand that it's where the silos come back, right? That we don't have to think that we have to sacrifice one or the other, and I'm constantly working on that with patients whenever they're going through decision making that involves both breast cancer and breast reconstruction. Is again, we really can have and in almost all situations, and sometimes it takes creativity, it takes understanding that you know one of the things I try to tell patients is you may see people that don't offer you things that aren't in their toolbox. But ideally, just because we don't offer something, it's not in our toolbox, it doesn't mean that we don't talk about it and that we don't send people to go talk to someone who does have that skill set. And I think that's the other thing, nipple sparing mastectomy, for instance, is such a good example, but there are so many of those, right? Whether from reconstructive to cosmetic surgery, that I think that ability to understand you may lose patients or they may go seek second opinions, and that's all actually great because ultimately you want someone that has the best fit on both ends as a surgeon and a patient. And so I feel like I do a lot of kind of getting people back and having a step back and say, oh, okay, I know you were told you need this, but not only do you like, we don't even need to do that if you don't want. And so it's a lot of education of patients, like that there's more out there than what you might have been told from the first person you saw.
With you doing this technique that's not as commonly performed, are you finding that you actually get a lot of people who come from out of town for it?
Yeah, most of our patients actually are not from the Bay Area. So we have patients from all over the country and actually outside of the country as well. So it's neat. I would say it feels like such an honor to have people be willing to fly across the country to come see us and to do this. What I've been happy though about over time as we've taught more people is we see more people who do have someone in their area, maybe who is at least open to it. We've
Yeah.
kind of taught people over the phone, so they've sent pictures of nerves. So it's been kind of fun getting to see that it's expanded out. But certainly most of our patients are flying from somewhere, especially ones who have a genetic mutation and do
Hmm.
have a little bit more time to make a decision.
To be able to plan. And do you
Exactly.
have surgeons that come and learn from y'all as well?
We do. Yeah, we have preceptorships, and we do some live surgery from the OR sometimes and do virtual teaching.
That's awesome. So, what are some things? So, a lot of times I like to ask people, what are some things you're excited about? You're already doing exciting stuff, but what are some things that you're excited about in the future of our field?
So I think it's been really neat to see the general idea of like how can we be less disruptive, and that's kind of across the board from both breast cancer, breast reconstruction, other parts. Like what are I think all of us, that dream of getting great outcomes with minimal recovery and minimal, impact on your life. But I think we're seeing that. I know like you and I connected over thinking about new implant techniques that allow women to literally come in and 15 minutes later leave with a beautiful breast augmentation, the minimal scarring and feeling great. Like, I think those are the kind of things that people are realizing. You and I are both, right, working surgeon moms. Like we're set up for the kinds of things
Yeah,
that
you're
get
like,
missed.
why don't there's no free time?
No. And so I think just seeing more of that, right? I think more of like injectable fat again is a great thing to think about. Like you don't have to recover from liposuction. You can have that done in the office. So I think in my mind, it's going to be a lot more of those less invasive, but still effective ways that we can give people the things they're looking for in reconstructive and in oncologic surgery. So I'm excited about that for sure.
I agree. I think that's really the direction we're taking. I think we're also going to have a lot more preventative things happening. Everything with the wellness sector now. I think that hopefully we will continue to take better cares of ourselves, and not just from an aesthetic standpoint, but like in general. I think that there's a lot more focus on the younger generation that wants to take better care of themselves. So hopefully that will also in turn mean that we're healthier and we're moving in a better direction with a lot of things.
No, it's amazing. I have a 14-year-old and then 11-year-old twins, and their skincare regimen, like, I'm pretty sure it's better than mine. And I think that is incredible that they're already everyone wears sunscreen every day. They really do. They're on it. And I agree with you. I think what we're ultimately going to see is people are going to they're going to feel better. It feels better to be in your body when you're taking care of yourself in that way. So much more active, in terms of exercise. And so I do think that's been a really incredible thing to see. I've also been loving recently, I was just talking to one of my patients about the focus on perimenopause. I think it's incredible that we're finally really actually looking at data and thinking about ways to get people through this period of their lives who've kind of just been ignoring for a really long time. And I do think that putting data into that, being scientifically based, actually listening to people, I think we're going to get a lot of health and wellness benefits from that as well. And so I'm excited to see, like 20 years from now, what does that look like? And I suspect people are going to be feeling better, and really feeling like, again, they've been taken seriously during this period of their life that a lot of women haven't for a long time.
Well, I mean, we're already in a place where we're like, "Oh, 40 is not 40 anymore." I remember my mother was turned 40 and people did the over the hill parties and, like, you
Oh,
got, like, and I was just like now I'm like, "I think I would kill you if you did that to me, like, when I turned 40," like, because it's just ridiculous now, your life isn't half over, and, so so it's like those just disappeared at some point, and I think that, like, yeah, who knows, like, soon, like, 50 will be the new 30, I don't know, so it's
no,
just
completely. I mean, I take care of a bunch of patients in their 70s where I'm like, that is amazing what you did today. It's from exercise to work to travel to, all the ways they're keeping their brain. It's really remarkable to me, again, that real focus on longevity, but also quality of your life. Like I will have people, like we have these nuanced conversations where it's definitely not the over the hill. Like they're nowhere close. They're more like,
yeah,
I'm gonna be
yeah.
here for the next 20 years. You're like, that's incredible.
So yeah, I think that I like that direction we're taking for
Yes,
sure.
agreed.
I also have to just say you're such a badass. And it's like you really are. I mean, like you have like you said, your mom, you're a surgeon, you've pioneered the field in plastic surgery, like doing all these amazing and like literally it was just like, hey, I have an idea. And that's like I think that's any entrepreneur, any person who it starts with an idea, but then you follow through and look at what you've done. So I'm sure your family is just so proud of you for all you've done. And, I know that you recently had shared on social media that, that you were dealing now with the recurrence. And I have to say, like, I was just like blown away because I know it's not easy to share something like that. But I think that you probably have no idea how many women you touched by sharing that and like all of your journey this time. Can I ask like how do you feel like you've been because obviously you still have a full load being a mom, being a surgeon, doing everything. How do you feel like do you feel like that by sharing it it's helped you some as well with how you're kind of coping with things right now?
Yeah, thanks for asking. I mean, I don't know, I think this is kind of a bigger picture discussion. I don't know if you feel this in your life too, but when I was first diagnosed at 37, I had started my practice a few years before. My kids were 6 and 3 at the time. And I don't know, I felt like I was still kind of settling into things. My practice was new. And it's really different now, 7 years later, realizing like, okay, like I built this practice. I've worked really hard at it. I've worked intentionally on my family. Like I feel really connected to my patients. I'm pretty involved in the breast cancer community. And so actually, I think sharing this time has been incredibly lovely just to get like the kind of connections you get and the things people say and the ways people reach out. It does feel very impactful, and it also feels very strong. It's a scary place to be in, but to know like that you've worked so intentionally to get your life to a place that you can handle this from, like I get to pick the very best team to take care of me. Like I feel really good about how I work out every day. My kids are awesome and on it, and they've been supportive and they can handle it. I didn't tell them last time because they were little, and now
Oh,
they,
they were so little.
yeah,
Yeah.
but now they're in.
Yeah.
Like my 14-year-old son, he comments on my social media posts. Like it's so cute. And so I have to say it really, like looking back, the difference now feels really good. Like I'm proud of that piece of it. But I also think it's very real. I just yesterday had to have an MRI as a follow-up before my surgery. And of course, an hour of not hearing back from the radiologist. I'm like, just like, am I texting? Am I not texting? What can I mean, again, I'm still that
You're
person that
like, is
has all
my phone on? Is it on?
yeah. I was like, she's just busy. She's right, or is she deciding like to not call me with terrible news? So I think it's also I would like to be able to share that because we're doing our best just like anyone else. And I think sometimes whether it's this cancer journey, but also like you're also very real in what your life looks like and the ways you talk about your patients and your family and your journey and your practice. And not all some days are really hard with our jobs. And again, I think for people being able to connect to like this is all real, and the things you're feeling, everyone else feels too. I love that on a personal level, and it feels like something to be able to add that I feel really grateful for.
Well, then thank you for sharing. And I know that there's nothing but love and support out there for you, and that you're going to kick cancer's butt again, and then be in even more amazing at everything you do.
Thank you. I know I'm in this place right now where I tell people, I was like, again, that's that pre-surgery, like you just get to feel really strong, get to do all the things. But then, I often say to my patients, I'm sure you say something similar, like the better you are going into it, the better you're going to come out on the other side. And so it's really neat to be able to take that and really, like, I've been lifting really hard. It feels good to be like feeling like I can get stronger and to have that. So I think whatever people are going through, if you do have that time, it's so huge to use it to get yourself again. It's not just physical, but all the pieces, right? It makes such a difference going into it. And so I feel grateful for that time for sure.
Well, and it's like now, like you said, you have this whole support team. Like your babies are now your support team too. So it's got to feel like really like loved and warmed and cared for.
Yeah, no, I feel really, really grateful.
Well, like I said, there's so many future things that we cannot wait to see what you end up doing. And thank you so much for being on the podcast today. And to everyone out there, check out Dr. Peled. She is amazing. Can you share your handle so if anybody wants to find you?
Oh, thanks. Yeah, it's at Dr. Ann Peled, Ann with an E and then DR.
And check her out because she has great educational content. And like I said, she's cutting edge. So you have to learn everything about her and continue to root her on as she continues on this journey. Thank you so much for being on the show, Ian.
It was so lovely. I love talking with you. Thank you.